I'd like to take this opportunity to welcome each and every one of you to the Celebrate One ceremony this morning. And from a personal perspective, we just want to thank each of you for coming and visiting as well, the Neighborhood House. I'm Charles Wheeler, the President and CEO of the Neighborhood House. And it is my distinct honor and privilege and pleasure to greet you this morning for such a worthy endeavor. The Neighborhood House, in case many are not aware, was founded over 105 years ago, helping immigrants transition into this great city of Columbus. Things have changed in 105 years. Columbus has changed, it's grown and prospered. Today, the Neighborhood House still serves the people of the community, all the individuals in our community. And I tried to find something that would kind of define the Neighborhood House in a nutshell. We have many different programs. I won't go through all of them today or this morning. But Euphrates, the Greek playwright, summed it all up, and I think this says what the Neighborhood House is about. The greatest pleasure of life is love. We at the Neighborhood House love this community and every citizen that makes it up. The doors are open, and anyone that walks through these doors receive love. We care about them. And the programs that we've developed support that, and each is administered with love. I think that kind of defines why we're here today, Celebrate One, because we want to ensure, working with the city and all of our partners throughout this community, that each child has an opportunity, each life has an opportunity to be loved and prosper and grow and develop and contribute back with love to our community. I have the distinct pleasure of introducing Ms. Donna James, along with co-chair Michael Fiorelli, who have provided strong leadership to the Greatest Columbus Infant Mortality Task Force. Both remain committed to the cause and serve as co-chairs of the Executive Committee for Celebrate One. In addition to the leadership she provides to Celebrate One, Donna is a trusted resource and advisor to business leaders in the public and private sector. She serves on the board of directors of numerous corporations and organizations, both locally and nationally. Donna is the managing director of Lardon and Associates, where her area of focus include corporate governance, business and leadership development, financial and risk management. Donna is also founder and board chair of the Center for Healthy Families, a nonprofit focused on transforming the lives of pregnant and parenting teens and their families. We are so fortunate to have her leadership and expertise to guide the effort to reduce infant mortality. And without further ado, ladies and gentlemen, I'd like to introduce you to Mrs. Donna James.
Good morning, everyone, and thank you. This is a moment we've all waited for, but it is just that, a moment, because what we have embarked upon and what we will continue is a momentum, and a momentum around something very important to our community. Thank you, Charles, for hosting us today. We're very fortunate for you and this organization in the neighborhood and around our efforts. We have a lot of people in this room. Many I know, and some I do not, and hope over the course of this I will get to know. I'd like to acknowledge and thank Senator Charlita Tavares. I saw her earlier. There she is, hiding behind the camera, always behind the scenes and out front when she needs to be. And similarly, we have council members Zach Klein, and I know I gave Eileen Paley a hug, so thank you. There may be others, and if I've missed you.
Shannon Harden.
Where's Shannon? Oh,
Right here.
Hey, Shannon, thank you. So I'm sorry? Oh, you're talking about Andy Ginther?
Yes.
Oh, yeah, him too. I have a special name for him. I call him Sparky. And I said that to him in jest, but I mean it in all sincerity because he is the spark that reignited this flame that was burning across this community around infant mortality. And we thank you, and he'll have more to say later. Neighborhood House clearly understands the importance of community engagement and that in order for us to solve this challenge of infant mortality, it will take all of us working together. What you are all doing to support moms, babies, and families is really making a difference. The more organizations who follow your lead, the sooner we'll see success, and the more babies we'll see celebrating their first birthdays. 1 year ago, we completed a process to understand the issue of infant mortality. We explored why it was such an issue for us locally, statewide, and nationally, and we invited resources in from around the country to help us understand how they were solving this issue in their communities. I want to acknowledge and thank all of the folks who are on that task force today. There were many of you. Some of you weren't sure why you signed up or why we signed you up, but I think by the end of that process, it was clear what we needed to do and how to go about it. And it was also very clear it would not be easy, but it would be worthwhile. And we already had a lot of resources and a lot of people already engaged in that. As you may recall, the plan we developed, it's complex. It focuses on key drivers of infant mortality in our community: babies born too soon or too small, sleep-related deaths, smoking, and most importantly, or equally as important, social and economic determinants of health. It's a mouthful, and it should be, because it embraces a lot that we need to address in our community. We then had to determine which agencies and organizations and systems were in the best position to implement these recommendations. And one of the things we acknowledge as we thought about our recommendations is that although overall the death rate for babies in our communities was not acceptable, the fact that African American babies were dying at 2.5 times the rate of white babies was clearly unacceptable. So our program, the agencies and organizations and systems that were in a best position to implement these recommendations were engaged. I'm pleased to tell you we had no trouble securing commitments from more than 10 different lead entities who are actively engaged, committing staff, resources to work vigorously on this work plan. With the plan completed and the recommendations assigned, we then launched Celebrate One, which we describe as our collective impact initiative. The name Celebrate One reflects the goal we are working to achieve, working to assure that every child born in Columbus and Franklin County lives to celebrate their first birthday, but also thrives beyond that. I'd like to take a minute to recognize some of our partners. There are very many, and so if I miss you, please forgive me. Central Ohio Hospital Council, Columbus City Council, Columbus Department of Development, Columbus Public Health, Franklin County Board of Commissioners, Franklin County Jobs and Family Services, Franklin County Families and Children First Council, Ohio Better Birth Outcomes, made up of our 4 wonderful hospital systems, Columbus Public Health, Primary One Health, the Ohio Department of Medicaid, and Partners for Kids. Each of these organizations have taken on specific responsibilities, and they're engaging others in the community as well as across the county and the state in this effort. Many of our partners are here today, and so I and the task force leadership, we want to personally thank you. We know a lot of you have been at this for quite some time, and some of us are catching up with you, and most of us intend to help you and get behind you to keep this moving forward. I also want to recognize the members of the task force who agreed to stay on and serve as the executive committee for Celebrate One. Special thanks to my co-chair, Mike Fiorelli, as well as the other members of the committee, Dr. Steve Allen, Dr. Charles Booth, Yvonne Honeycutt, Nathan Hurd, Dr. Teresa Long, and Anthony Trotman. Beyond these, we're also engaging organizations and individuals in each of our high priority neighborhoods, those with the highest rate of infant mortality. And you will hear in a few minutes, we're working to identify natural leaders in each of these neighborhoods, those who have the trust, the respect, and the understanding of how to reach and engage folks in the neighborhoods. It's only through this broad-based approach that we have any effort or attempt at realizing our goal of reducing infant mortality rate. And it may sound overwhelming to reduce the rate by 40%, especially when we talk about cutting the rate of death for African American babies by at least half. And when we say half, that doesn't mean we stop there, but we set a goal and we keep moving ever forward. Keeping Celebrate One moving forward and assuring good communication among all partners is the responsibility of many, but we put two people on point in this regard. Leanne Eagle, she's the director of Celebrate One. We're so happy we found her, and she's enthusiastically engaged and on board. And Erica Clark-Jones, who's the director of our community strategies, and they are an awesome duo. Combined, they have extensive experience in working in government, health policy, and probably equally as important in community relations and community engagement. They are both working tirelessly. I don't think they're tired. They look pretty energetic today. To assure we're moving ahead in a coordinated fashion. Just keep taking those vitamins and staying focused on moving the needle towards fewer infant deaths in our community. And with that, let me turn it over to one of our fearless leaders, Miss Leanne Eagle, and she'll highlight some of the progress we've made so far. Leanne.
Good morning. It is absolutely a pleasure to be here, and thank you, Donna James. She's been a great support to me and really provides, along with co-chair Michael Fiorelli, great leadership to our effort. And today, it's really a great day. We're pleased to be able to share with you some highlights of the work that's been underway and that we really are excited about. But at the same time, I think it's important that we always remember why we're here. We started this effort because of the realization that each year in Columbus, 150 babies die before their first birthday, and that amounts to about 3 per week. There's probably not a week that goes by, for those of you who follow the obituaries, that we don't see a beautiful face of a baby that's died before their first birthday. So as much as we're excited about what we have to talk about today, for those of us that are engaged in the effort, that's always top of mind, and that's why we're doing what we're doing. Donna shared with you our wonderful partner organizations who are implementing the task force recommendations. Each of these organizations that she mentioned has been working diligently on their part of the plan. I won't be going into the work of every single 10 organizations. I'm going to be sharing some highlights, but rest assured, every single organization mentioned has been doing important work that will lead us to our goal. As mentioned, one of the key drivers of infant mortality is babies that are born too soon. This happens for a variety of medical reasons, but we also know that sometimes moms and families will choose to have their babies early, prior to the recommended 39 or 40 weeks gestation. That, we know, is an important time where a lot of development occurs in that 38 to 40 weeks, so it's really important to the extent possible that babies go the full term. And so, in keeping with the task force recommendations, the Central Ohio Hospital Council worked with each of the delivery hospitals in Franklin County to enact standards to prohibit early elective deliveries without a medical reason. These standards have been incorporated as policy in each of those delivery hospitals, so at Mount Carmel Health Systems, Ohio Health, and Ohio State University Medical Center. No longer will a doctor be allowed to schedule a delivery prior to 39 weeks without a medical reason. Now that the policy's in place, so we have the policy, but it's also important to educate. So the hospitals and the council are working to educate the OB providers about the policy and to also to educate their patients about the importance of going, to the extent possible, 39 to 40 weeks and finishing strong, as the council has in their materials, their education materials. So congratulations to Jeff Klingler and the council for this important advancement. We know that the healthier a woman is before she becomes pregnant, really makes a difference in her pregnancy and in the health of her baby. Once pregnant, we know that a woman, the earlier a woman gets into prenatal care and stays in prenatal care, really does make a difference and contributes to a positive birth outcome. What we know, however, is that if women don't have health coverage, either Medicaid or private insurance, they are less likely to be able to access care, or they have trouble finding care and are less likely to even try to access care. That's why assuring that all eligible women of childbearing age in Franklin County and pregnant women are enrolled in some type of insurance. The Franklin County Department of Jobs and Family Services has made it their focus to prioritize this group of women, particularly those in the 8 high-priority neighborhoods where we know infant mortality is the highest. And their efforts have paid off. Just in the period from February till the end of May, they have achieved an increase of 5% of women of childbearing age enrolled in Medicaid and a 15% increase in pregnant women enrolled in Medicaid, particularly in those high priority neighborhoods. And that's really exciting news. This dramatic increase in pregnant women and women enrolled in Medicaid didn't happen by accident. Actually, JFS did a real focused effort to make sure that they could identify those women. They did outreach and then got them enrolled. They have a special unit at JFS now that will expedite. If a woman puts on her application that she's pregnant, that application gets expedited, and within 24 to 48 hours, that woman is enrolled in Medicaid, at least through presumptive eligibility or fully enrolled. They're also working with hospitals and the federally qualified health centers to identify challenges, what maybe is bogging down the process, and to identify those challenges and move forward. They've also placed caseworkers, satellite caseworkers in the area hospitals. So their goal is, if there's a woman out there that's eligible for Medicaid, let's get her enrolled, because that means she's going to get regular primary care and also prenatal care if she's pregnant. So that's really wonderful news, and congratulations to the folks at Franklin County Jobs and Family Services under the direction of Anthony Trotman for this great advancement. Sleep-related deaths, we talk a lot about that. Sleep-related deaths are certainly a key driver of infant mortality, and we know that the folks at Columbus Public Health under the direction of Health Commissioner Dr. Teresa Long have done really a terrific effort over the years of educating. And while they've done a terrific job, they're really committed to ramping it up and getting the word out. Just in the past year, I think just in the year ending at the end of June, Columbus Public Health has distributed over 450 pack-and-plays, the portable cribs, to families in need. These are families that would otherwise maybe not be able to afford one, and now they have a safe sleep surface to put their babies to sleep at night. In addition, they've continued their public awareness campaign through earned media, paid media, and a lot of grassroots strategies. We're excited because in the fall, Columbus Public Health will launch what we're calling the Celebrate One Safe Sleep Ambassador Program. So it won't just be the staff of public health that will be educating, they'll be doing trainings. So anyone that's interested in learning about the ABCs of safe sleep will be able to come to the training. They'll receive resources about the safe sleep, and they will be able to then go out into their communities to work to families, friends, colleagues, educate them about safe sleep. So this is really an effort to amplify that effort so that everybody in the community knows that babies sleep alone, on their backs, and in an empty crib. So congratulations to Dr. Long and the folks of Columbus Public Health, because they are tireless in their efforts to promote the ABCs. Providing support to women during their pregnancy is critically important, and it's been really shown to contribute to positive birth outcomes. Dr. Pat Gabby and her staff at Moms to Be can share countless stories of the success of just providing women with support and education that they may not otherwise receive. And just last week, our partners at Primary One Health, under the direction of Charlita Tavares, were awarded one of 4 evidence-based centering pregnancy programs. Only 4 were awarded in the state, and this is a program that integrates care, maternal care, education, and support, and follows some of the things that we've seen work very successfully with Moms to Be. So congratulations to Primary One Health, an important partner in Celebrate One, and we're really excited that we have one of those programs right here. Only 1 of 4 in the state is right here in Franklin County. So congratulations, Charlita. A key focus for Celebrate One is to provide women moms-to-be and families with the resources they need for healthy pregnancies and healthy babies. We're proud to announce that we now have a centralized hub where the resources can now be found. Today, we're launching celebrate1.info, the website for Celebrate One. It's designed to offer women, parents, and those who support them one place to deliver a healthy baby and to keep those babies healthy and safe during the first year of life. And here you see, this is the landing page for celebrate1.info. And as you see along the side there, the left-hand side, Celebrate One has 3 primary areas of focus: resources for moms and moms-to-be, resources for healthy babies, and resources for healthy communities. The site contains a host of information and links, everything from where a woman can enroll in prenatal care, the ABCs of safe sleep, profiles of each of the high-priority neighborhoods, and so much more. If someone wants to stop smoking, there's smoking cessation information in there. If someone wants to enroll in health coverage, you just click on there and you can get to the place you need to go to find out more information and get enrolled. The site also contains information for community members who want to learn more, who want to get involved, or if they want to donate so that we can, at Celebrate One, can purchase cribs, they can donate. The information is on the website. And also, the work of all those 10 partners that we highlighted earlier, the work of all the 10 partners is on the site. The partners are listed. You click, you can find out what they're doing for infant mortality and also link to their sites to get more information. Our hope today is that we can drive as much traffic as possible to this website, and we'll be taking steps to do that to get the word out about the website. We want to also continually add content that will be useful to people who go to the site. I hope that all of you here today, I think we're distributing cards which have the web address on it. I hope you'll all visit the site, provide us feedback with ideas about additional content that we can add. And also, I want to make sure that you follow us on Facebook and Twitter, which are also being launched today. And I assure you, I have someone much younger than myself who's handling that because I'm a little challenged in that regard. So those are just some of the things. I could go on and on. We all have a busy day, but these are some of the things. But I really encourage you, if you want to find out more about what we're doing, you go to the website and you will see exactly what we're doing for Celebrate One and really what we're doing for women, moms, moms-to-be, and families in this community. Now, it's my pleasure to introduce the individual whose leadership and commitment has gotten us here today and whose passion for reducing infant mortality is absolutely unwavering. It's my honor and pleasure to introduce to you Columbus City Council President Andy Ginther.
Well, thank you very much, and I appreciate the acknowledgement of my colleagues. This is one of the largest investments that City Council has made in recent years, so wouldn't have been possible without Council members Klein, Hardin, and Paley, and I thank them for their commitment to this, as well as to the mayor. Mayor Coleman and his administration have been part of this endeavor from the beginning, as well as the Franklin County Board of Commissioners. The commissioners have been outstanding leaders in their investments in Ohio's Better Birth Outcomes for years and have been great partners along with Director Trotman. So appropriate, Mr. Wheeler, that we're here today at the Neighborhood House Nest, a place where families and young children can get a healthy start in life, to talk about the work of Celebrate One and highlight the future engagement we'll be doing in communities just like this one. So a year ago in November, we stood inside City Hall and was joined by many of the folks here in the room today. We put a stake in the ground and said that this city's infant mortality rate is inconsistent with our values as a community. Nearly every day in our city, we are nationally and internationally recognized as one of the best places to get an education, to start a business, to visit. Our population is booming, our economy is thriving. But the fact that 150 babies die a year, 3 per week, in a city that is rich with medical and social services is unacceptable, and it must change. So the Greater Columbus Infant Mortality Task Force, co-chaired by the dynamic duo of Donna James and Michael Fiorelli, and the amazing assistance of Ohio's First Lady, Karen Kasich, helped to lead us through a process. And I want to thank Donna and Michael that are both here today, as well as First Lady Kasich for their commitment. Their leadership and guidance during the last year and a half have been greatly appreciated. and have been amazing. Complex social issues like the ones that impact infant mortality are not solved with one group coming together for some meetings. The task force and Celebrate One have never been about one group, one agency, or one department. And as Dr. Gabbies had taught me early on with Dr. James, the medical community alone could have solved this problem. They would have a long time ago. It is instead about an entire community, including political and educational leaders, medical experts, social workers, safety personnel, and others, all working toward a common goal. I'm told it's the most ambitious in all of America, but it's fitting that it's here in Columbus to reduce our infant mortality rate by 40% in Central Ohio and to cut our shameful rate of racial disparity in half by 2020. The task force helped to identify the areas of greatest need and resources in the community. Now it's time for us to put our work into action. We have the data. We need to craft policies that will once and for all turn back this scourge on our youngest citizens. I encourage you to get involved in your communities and neighborhoods and work with one of your neighborhood leaders to support the work of Celebrate One. We will not meet this crisis on behalf of our youngest citizens from City Hall, from our hospitals, from the Department of Health. It's going to be done and driven at the neighborhood level with the support and resources of the collective community. So today we're here to begin the next chapter of our commitment to Columbus families, to create a healthier, safer communities that will enable children to celebrate their first birthday and beyond. Because if we're going to meet our mission and goal of becoming America's Opportunity City, it's not just good enough for our youngest to survive, but for our youngest citizens to thrive and grow and develop into their destinies that God created them to be. So it is my pleasure to introduce our amazing Director of Community Engagement, Erica Clark-Jones, who's helping to spearhead our efforts in neighborhoods across the city. Erica?
Good morning. I have the awesome and wonderful task of engaging with our neighborhoods. This work cannot be accomplished, as you mentioned, President Ginther, without boots on the ground and voices of the residents. So I have the awesome task of working with our community leaders and community residents and mothers and families who have suffered a loss or who are just trying to get their child to their first birthday. In our minds, all babies matter, and that's what it's about. So I am happy to announce that in order to enlist and engage our neighborhood collaborators, we have kicked off a series of community conversations in each of our Phase 1 neighborhoods that we are looking at for Celebrate One. They include the Near South area, which includes the Livingston Avenue corridor and the Northern Parsons corridor. The Near East area, which is north of Broad to 670 and the zip code 43203, and the South Linden neighborhood. These series of community conversations capture the voices of the residents in the neighborhood to help us craft strategies and interventions that will have an impact on families today and for generations to come. We've started this series 2 weeks ago, but tonight I invite everyone to participate in the community meeting held at the Parsons Avenue Library from 5:30 to 7:30. We have a series of 6 meetings occurring in each neighborhood, and each of these meetings will be listed on the website later this afternoon. That's all I have, but I just would like to say it's a pleasure and an honor to serve with so many of our great leaders in our community to help all babies thrive and celebrate their first birthday. Thank you.